So what are some of the things that we can do to increase blood flow? A technology that I recently started using about a year ago is called GAINSWave. GAINSWave uses low-intensity extracorporeal shockwave therapy, and it basically can optimize men's health. It can optimize performance. What it does is it creates a small injury. Injury then sends a message to the brain. The brain releases mediators, mesenchymal stem cells, to go to that site and increase blood flow by causing what's called angiogenesis. So actually the GAINSWave treatment, which has been very popular lately, and it's available all over the U.S., we do it in New York City and my Westchester location, but it's involved everywhere, but it's for two things. It basically helps increase blood flow, and it does that by angiogenesis and
angiogenesis means growing new blood vessels.
Correct. So anytime you have an injury, your body is trying to repair that injury. And our natural repair mechanism is stem cells. So you have a cut on your finger or a shave. You're shaving and you have a cut. What happens in 2 days? It's healed. Why does it heal so fast? We have a self-repairing mechanism. So this low-intensity shockwave therapy, GAINSWave, basically gives you this small injury. And we're all familiar with shockwave therapy for lithotripsy, right? Lithotripsy is higher intensity for kidney stones. So this is low intensity. So the GAINSWave therapy basically works by angiogenesis, new blood vessel growth, and growth factors, bringing new growth factors to the area. Usually we do a treatment once a week or twice a week. It's about 6 sessions. It doesn't hurt. It's not painful. It's non-surgical. It's not invasive. Patients see results, significant. We're getting great responses. And usually we do 6 treatments or 12. Some people have Peyronie's disease, which is a plaque, a fibrous plaque, an injury to the penis. This has been curing it in patients.
Incredible. That's incredible.
And these are young patients that we're seeing, 30s and 40s. Some 50s and 60s, but we're seeing some great results with GAINSWave therapy. So
does it when you get like 6 or 12 treatments, is it a temporary result or does effects are longer lasting?
We're seeing results lasting up to 2 years.
It's sort of like having a cardiac bypass in a sense, right? You get new vessels.
Well, yeah, not exactly. I mean, that's the mechanism of it. Let's say you exercised your whole life compared to someone who was sedentary their whole life, and you both had a heart attack.
Yep.
From the books, remember some of these studies, the person who exercises is going to have a smaller heart attack. The person who doesn't exercise will have a larger heart attack. What does exercise do? Grows new blood vessels. So, if someone who exercises a lot, who has some blood vessel growth, but sort of like is having a lot of ED issues because they changed their diet, they have some inflammation, and their blood vessels are kind of like constricted. This will help knock off some of the calcium inside the vessel wall. It'll increase dilation of blood flow, bring in more growth factors, and basically...
So it's like regenerative medicine for the penis, basically.
Correct.
And it may allow you to throw away your Viagra or Cialis, right? So
Cialis and Viagra work locally on the penis by phosphodiesterase PDE5, receptor inhibitors. And what this is doing is you're inhibiting constriction, so you're dilating. But there's other side effects with some of these medications. It reduces blood flow to the eye. Sometimes you can have visual changes. You can have increased reflux by reducing lower esophageal sphincter pressure in the esophagus. Sometimes they're great, like Cialis 5 milligrams daily is great for people with BPH because it reduces the pressure on the prostate and allows you to urinate better. That's been a help with a lot of patients. But sometimes combination therapies help.
Yeah.
Like we mentioned exosomes before. So now we're taking exosomes and we're doing what's called an XX shot or an XY shot. And basically what that does...
We'll call it a P shot, is that it?
So I actually trained with Dr. Rennells and learned PRP and did a lot of PRP, the P shot, the O shot, which helps a lot of women and men. But that's with their own blood. We spin it down and we re-inject it back into them. So we're getting some growth factors.
Yeah.
But if you compare PRP with some of the new therapy, exosomes, you're talking about, a tremendous increase in growth factors that basically make the result so much more powerful. So, I'm doing some PRP now, not as much. I'm doing a lot more exosomes. I think exosomes will be the future. I know
those
a lot of
injected directly into the penis or
sexual
organs.
You go right into the penis. You numb up the area. Sometimes you can do a nerve block. It's no pain at all, and it takes about 15 minutes. and the response is significant. Patients with prostate cancer who have decreased sensitivity, who got radiation, who now can't get an erection, now suddenly can get an erection after an exosome injection.
That's amazing.
Yeah.
So how's GAINSWave different from other treatments for erectile dysfunction or performance enhancing drugs?
Well, because the GAINSWave is the only therapy that's basically using low intensity shockwave therapy.
So it's not pharmacologic. It's not invasive.
It's drug-free, non-invasive, surgery-free. It improves blood flow, gives a better erection quality. You have harder erections, more full erections. Sexual performance is improved. And actually, a lot of patients will come who are younger who want to increase performance. They have good erections, but they want performance. They want to be able to last longer. So they come in for performance issues, not ED issues. And then we have maintenance. Once the patient goes through their 6 or 12 sessions, they'll come back once a season and get a maintenance treatment. But the combination thing of exosomes, PRP, or
diet, exercise,
and GAINSWave, exercise, so important. Diet, eating less sugar, keeping those vessels dilated, very important. And we're seeing, it's a safe procedure too. Everyone's concerned about, surgery. I mean, I used to send a lot of patients for bypass, coronary artery bypass graft surgery. It's if you need it, you get it. But I mean, right now we're trying to do multi-vessel stenting, and I can speak for hours on just cardiology and traditional, disease management. But I mean, here we're talking about, more natural ways to stay younger and healthier and live longer.
It's great. It's really great. And I think the thinking about aging as a process that's not necessarily inevitable. We can, with a little effort, work, and intelligence, use lifestyle plus various innovative treatments that are regenerative to actually optimize, maintain our health, and even reverse some of the things related to aging. I look at myself, the more I've understood about diet and exercise, the more I've implemented it, the better I am. I can tell you my bone density and my body composition was better than even just 3 years ago. Even though I'm getting older, I'm getting healthier.
So you want to talk about your results?
Yeah, let's do that. So before we go with that, where can people get GAINSWave? How do they find out about it? If they're trying to be curious, what do they do? So
we have an office at 40 Wall Street in New York City, and we have an office in Westchester, 4 Westchester Park Drive. That's our main office in Westchester County, where they can get GAINSWave. But we have GAINSWave centers, in other places all over the U.S. It's not just here in New York.
So they go to a website.
There's actually a few places in New York, but I'd rather them come to me as a cardiologist.
But if you're not from New York, you're listening, and maybe you're in
Kansas. So there's a website. I'll provide you with the websites of all these companies.
GAINSWave.com?
Well, there's